Sure. So we presented the full results of the dose escalation and dose exploration phases of our phase one trial. And this is a bicistronic CAR that dual targets EGFR and IL-13 receptor alpha 2. And the product is delivered intracerebroventricular, so that is direct injection into the spinal fluid using an Ommaya reservoir that gets placed into the patient's lateral ventricle of the brain. And so we reported on the 18 patients, and this is a phase one first in human trial. So of course, establishing the toxicity profile and the safety profile and identifying the maximum tolerated dose and the recommended dose for expansion were really important endpoints which we were able to do. We now have a much better sense of the toxicity profile, which is essentially fevers and acute neurotoxicity, both of which are reversible and manageable. And we identified 25 million cells as both the maximum tolerated dose and the recommended dose for expansion that we're using moving forward. We were able to see really excellent expansion of the T cells, both in the spinal fluid and also to some extent in the blood of all of these patients. And we saw some exciting early efficacy signals. It's a phase one, small study, so none of this can be really, reliable until we do larger studies. But we do see a fairly high rate of tumor shrinkage, which we generally don't see with other things in glioblastoma. And we do have a small subset of patients who have had durable disease control. And this has included a patient who entered the trial with leptomeningeal disease, which typically carries a weeks to a couple of months life expectancy in glioblastoma. And that individual was over 16 months without any tumor recurrence at the time that we had a data cutoff for the presentation. So that was a case of a very remarkable responder. But unfortunately, a lot of the other patients do progress within a few months of the first treatment. So moving forward, we're of course working hard to identify mechanisms of resistance and try to design the next versions of this product and combinatorial approaches and other things to increase that response rate and increase the durability of the response.